How you doing? It's Dan at Kent Boot Camps. I hope you're well, having a great week. We're back, thank God, for some video blogs, whatever you want to call it. And we're going to be talking about how you can avoid injury, and particularly probably the most common injury we see at boot camp and in general is knee problems. The big bad knee. So we're going to luckily talk to Steve, our new recruit. He's a superhero, osteopath, physical therapist. He does everything. So if you want him, he's the man. He's going to give us some insight on how we can detect whether there's a knee problem at the knee, what causes it, and some tips on how you can avoid or improve the function of your knee. So take it away, Steve.
Okay, so knees. Okay, so we've all experienced knee pain, whether it be at the front, whether it be at the side, whether it be at the back.
Yep.
Okay, now one of the reasons for this is because the knee, it's not an unstable joint, but it's an overworked joint that sits in between two stable joints.
Yep.
It sits in between the hip and it sits in between the ankle.
Yep.
Now, a lot of therapists dive straight in at the knee, a lot of soft tissue, a lot of articulation. But if there's dysfunctions higher up and dysfunctions below, we're not actually fixing anything. We're treating the symptoms, we're not treating the cause. What we want to do is keep you fit and healthy and pain-free.
Yeah.
So today we're going to focus on the ankle.
Okay.
And the restriction at the ankle shows up certain signs. So what we're going to do is trying to put exercises that are common in the boot camp.
Yep.
And show you good technique and bad technique and what to look out for, and then we can go on and we can try and fix it with a couple of corrective exercises.
Sweet. Okay, you want to do me some, I want to do some stuff.
Okay, so I'm going to get Dan to do a full squat, and we're just going to hold the squat at the bottom, and then we're just going to come around and have a look at his range of motion. So you can see he's 90 degrees at the hips, and we're getting full. This movement in the ankle here is called dorsiflexion. So what's happening? Yeah. So what's happening here is the muscles of the calves and the Achilles tendon are allowing this movement at the ankle to allow him to get down to that bottom position. So just do a couple more for us, Dan, and you can see you can get full range of motion. You get some nice extension through that spine, and you can see flows. Lovely technique. This isn't the only movement at the ankle. We're just going to focus on two of the movements, but all joints have three planes of motion. Okay, so we can get Dan to just do a couple of lunges for us. And what should happen here, if you have a look at the way that he's rotating over that front leg. Now, the foot on that front leg, the arch should drop towards the floor and allow him to get over that knee. So what's happening here is we're showing you that the internal rotation of the knee works with internal rotation of the hip and the internal rotation of that foot.
So internal rotation is essentially into this twisting
into that position there. So what we get Dan to do now is show us, if you didn't have that movement at the ankle, what would happen at the knee and how much strain that would put on the inside of the knee. Now he normally does a face here because he's in that much pain, he can't understand why.
Let's stop.
Okay, so what we're going to do now is I'm going to get Dan to just show you a couple of stretches that you can do, and it will really help with this knee pain, but it'll help in improving the range of motion through your squat and your lunge. So we're going to start with the chair pose from yoga. So as you can see, he comes down, we're getting some nice lengthening through the calves, and you're looking to hold that position for about 90 seconds. That's good. And now what I'm going to do is get him to face me, and then we get him to drop down into the squat for me.
Full squat.
So he's going to come down into a full squat. Now this is a nice position to be in. A lot of people can't get down this low.
So you want to hold on to something generally.
So you want to hold on to something, and again, hold it for 90 seconds, and this will really improve all the tissues around the ankle and the hips.
Definitely.
Now that rotation in the foot, we're just going to finish with one exercise, the single leg, coming over the single leg and driving the arm to the side.
So here?
No. That one.
All right.
And drive over to that side of the knee. No. Do me.
Come on, I'm not listening properly. Come on, Steve.
Okay, so we were talking about this internal rotation coming through there. So this one exercise, quite nice exercise to get all them three planes of motion going on, to try and get that foot dropping in over that big toe, which is important in walking and running. So you would just take this leg to the back. If you have to hold on to the wall, hold on to the wall. If you're a little bit unstable, you would just come forward and you would just drive over to the side, foot goes down, get stable again, leg out, keep the chest up.
Keep that going, let's have a look from the side. Go on. Go on, say again.
I'm keeping this nice curve in the back and coming forward before, with the legs coming up and coming over to the side, and what that's doing, it's allowing us to keep this motion side to side. So on your lunges, we're not overstraining the knee, we can get over and we can rotate, and that knee can drop in, it's not coming in too far, and that foot is dropping in. We can get down in a nice lunge, nice and upright, and we can keep you injury free.
Sweet. So there we go, number 1 on a series. Hopefully going to do this every week. Any questions, any information, Steve's now about. If you want a proper assessment one-to-one, he's the man to do it. Or you can grab one of us at boot camp and we can take you through some stuff. I hope you have a good rest of the week, and I'll see you probably this time next week. Take care.